Hey, it's Caden. It is April 19th, 2010, and today marks 5 weeks post-op top surgery, so pretty exciting. I have one more week to go before I'm fully healed. I just took the tape off to change it, so I'll put some of that on. I'm supposed to leave that on for another week. Might leave it on for another 2 weeks. I don't know. It's probably not necessary, of course, and my doctor I know would say it's not, but I like to be safe, and I can start scar treatment then starting in a week or whenever I decide to take the tape off, keep it off. Everything's going well with it. Like starting right away at 4 weeks, like that day it wasn't as sore as it had been, and I said I was going to leave the ace wrap on a little longer, and I did, until like the next right at 4 weeks, I suppose. I left it on most of that day. I took it off at night because it was 82 degrees and I was sweating, and I left it off for like 2 days after that. Like that night and another day and part of the next day. And then I did a lot of work outside in the garden at work and got really sore. So then I put the ace wrap back on, and when I lifted something heavier than I should have, I also noticed that I got sore from that. So I really try to take it easy. I haven't been stretching or lifting or working out or anything, so I really have been doing a good job. It's just those little extra activity, which is fine. It's just what I'm not used to, and it moves it around, so I think that's why it hurts a little bit. But it's doing good. So I wore the ace wrap on after I did that gardening stuff a couple days, and it helped. Just felt better. But I like not having the ace wrap because can't really stand up as straight, and it really hurts like right here in my sternum when I have it on. I don't know why. Still sore there, but it hurts a lot when I'm wrapped. So you can check the other video for a real close up. But this is it. Right drain's a little like, I don't know, indented, you know. It's got the extra tissue here, or swelling. It's my right side, and I'm right-handed, so hopefully it's just a lot of swelling. The nipple is the one that kind of screwed up, but I don't mind it at all. It's also the one that had a nipple ring, though I don't think that's the case of why it didn't quite attach. And there's this one. This is where it's always had that hard kind of ripple, and it's painful. So when I can start doing massaging and Mederma, that's what I was trying to think of, then I will start to massage it, and hopefully that'll help. But incisions and stuff look great. There's still kind of that stretch marks, which I'll use Mederma on, so maybe that'll help. But it's not too bad. There's still numbness, and right here, numbness in my nipples, and a little bit down here, but that's pretty much it. So it's doing really good. I'm happy about it. Last video, up close one, I had something at the end that I was going to say, and I could not remember what it was, but I remembered it right after I turned the camera off, of course. And that was about acne and about hair. Since I upped my dose, I'm getting a lot more chest hair because my dose was like really low. Just my T levels were low. My dose had kept me good T levels for a while, but then all of a sudden it was really low, and had been for a while. So I doubled it to 0.50 milliliters every week. If milliliters is a measurement in a syringe, I never remember. And I've got a lot faster growing facial hair, a lot more hair here and here, which I'm not that happy with, but it is what it is. I'll trim it, whatever. Ow. That stretching hurt. Oh, it was acne. I've had a lot more acne too. Like, my chest has had a lot of acne, but that was especially from ace wrap and binding, and my back is getting a little better. But my head has been getting acne. And I watched another guy's video a couple days ago, and he said that his doctor said when he had acne on his scalp that it meant he was going to lose his hair because it was getting very oily. So it makes me kind of worried because I don't want my hair to fall out. So if anyone has any advice on that, his doctor lowered his dose since he was kind of high anyway. So maybe I'll do that myself, and just lessen it, see if the acne kind of goes away. We will see. Sorry, my cat's outside. Yeah, so let me know if you have any advice on that, or if it's true, or I mean, this is a good, well-known doctor, a trans doctor too. Like, this person is trans, so I would think they would know, but just in case, let me know. Anyway, 5 weeks post-op. Let me know if you have any questions. It was Dr. Steinwald at Lake Forest Plastic Surgery. It cost $7,760. Alright, talk to you guys later. Bye.